This weekend, a documentary team will be in Colorado for a storytelling summit. Their goal is to capture the stories of cannabis-induced psychosis.
And this is not something that has been widely studied. We do know that there is a link between marijuana use and acute psychotic symptoms, but there's not a lot of data on how many cannabis users experience these symptoms or what a safe amount of cannabis might be for the average user. Anecdotally, we know that many people use cannabis safely, and some rely on it for medical purposes, but we have heard stories of psychotic episodes. And those are the voices that will be highlighted during the Storytelling Summit this weekend. We are joined now this afternoon by Whitney Yeager, who helped organize the summit. So first, can you tell us a little bit more about CIP and what happens to a person who has it? I don't know how many people really know what CIP is.
Cannabis-induced psychosis is a condition that people experience if they smoke high-potency pot. And it's characterized by delusional thinking. They'll hear sounds that are not real. They'll see things. They'll have hallucinations. I can speak about my son's experience, which was that he experienced, he thought the FBI and the CIA was after him. He thought that he was highly paranoid, and he was obsessed with conspiracy theories. He had a cognitive decline. So it's different in different people. Psychosis, it can be violent outbursts. It can be, people have committed murder on this. They have shot loved ones. They have stabbed loved ones. And there's actually quite a bit of research that supports that cannabis-induced psychosis causes anxiety, it causes depression, suicide ideation, and actually schizophrenia, especially in males. So it's not a topic that is widely covered by the mainstream media, so thank you for the invitation to talk today. This storytelling summit was a dream of mine, really. And when I saw Glenn Muse, who is the director and producer of Texas Pictures, he did a very good job of covering the fentanyl crisis, and I wanted him to tell my son's story.
And you have such a personal connection with this, so kudos to you for having, the bravery and the strength to even be on TV and talking about this.
Thank you.
That why you wanted to be involved and to share this story, because it is something that your family experienced?
It is deeply personal. I mean, it's the biggest tragedy in my family, for sure, losing my son. He was one semester away from graduating from University of Colorado. He was 23. He died April 3rd, 2021, as a result of interaction with police. And I know that there is a real mission behind this. I am here representing many, many other families who have lost their children to cannabis-induced psychosis, mainly by suicide, but by other means as well, like my son's story. And there's just not enough awareness about it. And it's really important. We have to get the word out and educate, especially middle schoolers and high schoolers and college students about the dangers of high-potency pot. Back in the 80s, it was 4 to 7% THC, and now it's 40 to 95% THC in dispensaries, and it can send people who are neurotypical, neurodivergent into a total psychotic episode. Even if it's just the first or second time of smoking pot. So it doesn't matter how many times you've smoked
I didn't know
it.
the percentages had gotten that high. Did you? That's
yes.
crazy.
The percentages have, I know, have increased. I did not know, to your point, to that drastic of a number. I have to ask you, because you brought up like neurodivergent, neurotypical. Is it particularly that demographic that is more exposed or have more of a risk when it comes to CIP, or is it generally based on what you have researched and experienced?
The research shows that it doesn't discriminate. It covers all population. I think there was a myth around it being affecting people who had predisposition to mental health issues, but that's been debunked. That is no longer true. So it doesn't matter. And if you experience a psychotic-induced episode from cannabis, you are 47% more likely to develop schizophrenia. Just one episode. So, and that's a study that just came out. But it just takes a simple Google search to find thousands of studies. The Lancet, the journal American Medical Association, has produced peer-reviewed studies linking it to all of these things that we've been talking about. So there's a lot of research, and it's been out there. My son was diagnosed with cannabis-induced psychosis 5 years ago. And so it's not new. There's an insurance code associated with it now. There's, it will be in the DSM-6 edition once they revise it from the DSM-5. It's a clinical problem that they see in emergency rooms all over the country now all the time.
Well, Whitney, thank you. I certainly learned a lot during this interview, and I'm sure a lot of folks at home did as well.
Thank you.
Thank you for being here and sharing your story.
I appreciate the opportunity. Thank you.